Hello, everyone. My name is Dr. Jennifer Hobson. I'm the director of the CranioFacial group at PhysioPartners. We are called the Renaissance CranioFacial group. This webinar is all about snoring and what you can do to reduce snoring and improve your sleep. I'm going to go ahead and share my screen. So you'll notice there's a Hobson Institute and a PhysioPartners logo here. The Hobson Institute is all of the online breathing training that we have. The PhysioPartners Renaissance Craniofacial group is actually the hands-on physical therapy to help reduce snoring. A little bit about myself. I started the Hobson Institute, which is an institute focused on head and neck breathing health due to the lack of focus in this area in the medical profession. I earned my doctorate through the University of St. Augustine in Florida, specialized in craniofacial therapy with my mentor, Dr. Mariano Roccabato, who's a leading TMJ expert in the field of PT and dentistry. I'm also trained in something called Myofunctional Therapy and Buteyko breathing. I'm also getting certified in the Laney restorative breathing technique. So breathing retraining program, what is it? We offer breathing clinics through the Hobson Institute, which are 3-session group Zoom clinics right now because of COVID, with a 4th review session. I have trained my staff at PhysioPartners, Renaissance Craniofacial Group, to provide the hands-on care that goes along with the treatment of the breathing retraining. This consists of myofunctional therapy, which we'll review in just a little bit, and the breathing retraining techniques. Treatment typically is covered by insurance if you come to us at the Renaissance Craniofacial group. These are the names of the therapists that can help you with this. Jennifer Hobson is me, Renuka Chilawar, Carl Warham, Kathy Matthias Riggs, and Kenneth Tsai. Now, posture really is a big part of why people end up breathing improperly. So look at this image. You have someone with really perfect posture here. And the perfect posture really will allow the head weight to stay at about 12 pounds. And it loads with gravity your spine and it compresses it at 12 pounds. If the head goes forward, that increases the load to 32 pounds. If it goes even further than that, that's about 3 inches, 42 pounds because of this lever arm. Now you'll notice right here, the neck posture. Do you see how his neck is going, his chin is going forward, his head is going back. It's almost like he's posteriorly rotating his head on his neck. This is called an airway posture. It's compensatory because there is an airway compromise in the back of the throat. So while this position, it actually opens up the airway, it does cause an increased muscle tension because your head's in front of that center of gravity. And it causes compression to your neck and even clenching. This is just some anatomy review. If you look at this, this is basically your airway without your face in front of you. So if we take off your face, here's your nose. There's a septum. If you open your mouth, you'll see this little dangly uvula. Those are your tonsils. And you have the epiglottis here. So these are the nasopharynx, the oropharynx, and the hypopharynx. Down here is the esophagus. Now, if you look at this picture, what keeps the airway open, and this is the airway here, is the support of the tongue. So some of us are mouth breathers, and mouth breathers will always have a problem with their airway because their tongue is no longer filling the oral cavity. See back here, this is the soft palate. That soft palate, when it is not supported by the back of the tongue, it falls into the airway. This image, you'll see 4 different classes of what we call the Malinpotty Classification. It's an airway classification. It helps us see how well in this case, Dr. Malinpotty was an anesthesiologist. He wanted to figure out how hard it was to intubate people. So if you're a Malinpotty 4, you can't even see the airway. It's hard to intubate you. That is a problem if you ever need surgery. You'll see class 1, you can see under the uvula and there's lots of space. As you progress to class 4, it's less and less space visible in the back of your throat. So I encourage each of you to get a mirror out and look at the back of your throat. See if you can see the back of your throat. If you can't, you need some tongue training. The more you tongue train, the more support the back of your throat gets, the more airway support, the better your posture will be, and the more relaxed your face will be. Now, look at this image. Do you think that tongue fits in the mouth? It doesn't. It creates a problem because it's just not quite fitting. We're going to go over where our tongue should be. These are images. If your tongue does not fit, you will see something called scalloped tongue. So the none, mild, moderate, severe, here you don't see any. Here this is mild. You start to see little creases of your teeth on your tongue because your tongue just doesn't quite fit. And this is increasing degrees of it and even more severe here. This is a sign you have a breathing problem and that your tongue does not fit well in your mouth. This is the ideal position of the tongue. This is what's going to really help your airway stay open. Notice the tip of the tongue is up on the roof of the mouth and the entire tongue is up on the roof of the mouth. This is the soft palate. So we want the entire tongue up. So I always tell people, try to cluck a little. See how you can feel that suction? Now keep your mouth closed with your little bit of suction above your tongue so there's no saliva that you leave there. It's nice, a nice little seal of the tongue up on the palate. Now, notice here, if the tongue drops, the tongue falls back into the airway. This is not what we want. We don't want any gaps here. We want the back of our soft palate to stay up. So notice the tongue will fall back into the airway if the tongue is not positioned up. You want a gentle suction of the tongue to the roof of the mouth. Now, when you have proper tongue posture as you're growing from childhood to adulthood, you end up with a nice, big, wide arch. This is your upper arch of your teeth. This is your lower arch. This is your tongue. Now, this is the position where we want it to be up and supporting the entire surface of the roof of your mouth. Now, this is looking at you from behind. Notice the tongue isn't up there anymore. And also notice that the size of the palate or the roof of the mouth is more narrow. What does that cause? If the tongue did not spread that palate wide as a child growing to an adult, it becomes narrow and it stays narrow and the tongue has to fall down. So we don't want this tongue posterior position. So I mentioned before, myofunctional therapy. Myofunctional therapy, not enough people know what it is. Some dentists do. Not enough doctors know what it is. You're not going to get prescribed myofunctional therapy unless you go to an airway specialist or hopefully a sleep doctor that has heard the term and been educated about it. What is it? It's all around nasal breathing. So a lot of snorers mouth breathe either at night or all day. We train lip seal. Why? Because if you're mouth breathing, your lips are apart and you don't have a lip seal. You need a lip seal. Proper tongue posture. We just discussed that. We want that support in the back of our throat. Correct swallowing pattern. Okay, so swallowing, believe it or not, when done properly, keeps your airway nice and supported and wide. Some people swallow improperly with a grimace swallow where they purse their lips, or the crane swallow where their neck cranes forward. And there's a lot of tension in their face. That is not a good support for the back of your throat, and it will not help support good airway health. So this is a myofunctional therapy kit. This is what we need for that type of therapy to really train the mouth, to strengthen the lips, the tongue, position the tongue, swallow properly, and breathe properly. Those are really the goals for myofunctional therapy. So here's some exercises, and don't laugh because I'm going to make you say some really silly sounds. Okay. This is training your soft palate. To improve your airway, we're going to repeat these sounds to make your soft palate move up and down. Remember that soft palate's falling back. And if you can't see the back of your throat, I encourage you to do this with a mirror, with a flashlight, and see that back of your throat move. If you want to be able to see the air tube, you need to activate the soft palate. You need to strengthen it and lift it, okay? So these are the sounds. And again, you're allowed to laugh at me, but these are really silly sounds that help improve airway patency space. So the first one is ka, ka. I'm going to stop for a second and stop share. So you're going to try ka, ka. 5 of each of these. And then ark, unk, ark. You might even see my uvula when I do this. Unk. And I'm trying to hollow my throat. Ark, unk, ka, ka. Then I say hawk. Try to hollow out your throat. Hawk. Sounds like hawk, but you want to make that noise. Hawk. And go. Go. The back of the tongue goes up and down. Remember, the back of the tongue gets really lazy and a little fat in many of my patients that have their tongue down all day. Low tongue postures cause clenching and a weak tongue and a lot of extra skin right here. Okay, next exercise is the point. We combine the waggle spot and the tongue point and trace. So it looks like this. Again, this is to tighten up the tongue. Sometimes the tongue is tight, is a little fat in the mouth. You're going to point. You're going to go right, left, right, left. Up on the spot. Draw a line all the way back to the uvula. And you hold it there, hold it. Try to retract your throat. I'm going to do it one more time. You want to disassociate your jawbone from your tongue. So you tongue-tied patients, you're going to see a shift of your jaw back and forth. Try this. Stick it out, right, left, up on the spot, draw it all the way back, and really retract the back of your throat. Out. I know it's very attractive. All right, next one is the cave. You're going to suction up. Do you want to really get the tip of the tongue in the end position? Suck the air and the saliva above the tongue out. Open your mouth with that suction and let it snap. And I believe there is one more. Tongue point and trace. Okay, so this, we've gone through all of them. You're supposed to perform them around brushing your teeth. That way you remember to do them twice a day. So your twice a day airway exercises are 5 to 10 of each of the arc, ka, ga, and hawk. Then the tongue point and trace, I do 10 of those. And the cave, the suction up. And every day, I encourage you to look back here. Open your mouth and see, do you see your airway? Get connected to your airway. You want to make sure it's there and that you are not compromised there and ignoring it. If you snore, chances are this is a 4 that you can't see under here. myofunctional therapy is not just, it's not just made up. This is evidence-based. There's plenty of research that show that it helps sleep apnea and snoring. So these are techniques that have been around for many, many years that are research-based, and there's plenty of research to show you that it helps snoring, sleep apnea, headaches, clenching, and ADHD, and also breathing. So breathing, swallowing, all of that. But know that this is something that you should know helps snoring. And at Renaissance Craniofacial Group, we provide this under insurance, medical insurance. Okay, so a little bit about the breathing aspect. This is Constantine Buteyko. He was a medical doctor in Russia that figured out that the sicker you are, the heavier you breathe. And he was monitoring the breathing volume of patients as a practical assignment in his hospital. So Buteyko was actually able to reduce his own high blood pressure by practicing simple exercises to reduce his breathing. So a little bit about volume. What people don't know is the volume changes when your mouth goes open. Okay, so at night, if you're mouth breathing, we want it to stay at 4 to 6 liters per minute. But this was what's abnormal. You have a breathing volume up to 3 times the normal with people that have asthma and also people that have sleep apnea. So breathing heavy and breathing big and open your mouth breathing, that's going to cause a change in how much volume goes in and out of your body and how often you breathe. Traits of dysfunctional breathing. Okay, so what are they? You got mouth breathing, fast chest breathing, audible breathing when you can hear it, when you always sniff and sigh, you go clear your throat, always sniffing, talking and taking big breaths before sentences. What I didn't tell you is that I'm actually a breathing patient and I speak a lot in public. So I have to really stop, take a gentle breath in through my nose and talk, because otherwise you suck in and talk, you're basically mouth breathing the entire time. If you don't nose breathe in between, take breaks. Yawning with large volume breaths. So any of you that are yawning all day, know that that's a breathing dysfunction and that there's something you're missing about how you're breathing, that you can improve that. You also don't want this. You don't want lots of visible movement in your chest. So what are traits of good breathing? Simple. Keep it simple. Breathe through your nose. Breathe slow and low. What does low mean? Use your diaphragm. The lower part of your lungs has the most gas exchange, and it's more economical and more efficient to breathe there. So the importance of nasal breathing for sleep. So mouth breathing at night actually increases the risk of snoring. It also increases your risk for sleep apnea. So for those of you that are snoring, chances are you're on the path to getting that sleep apnea. And who wants to have that device on their face or that jaw mandibular anterior positioning orthotic in your mouth? This is not an adult thing. Children get sleep apnea. So this is something that's occurring across the board at all ages. We don't actually have the statistics on how many children mouth breathe during sleep, but we kind of have an idea that it's 25 to 50%. Adults that are 40 years of age are 6 times more likely to spend 60% of their time breathing through with their mouth open. What happens when your mouth drops open? When you mouth breathe, what happens? So here's the 2 things. Your mouth dries out. Your throat dries out. The moisture is driven out of your airway And this leads to inflammation of your air tube and your airway. As your airway gets inflamed, it'll get narrower. As the airway gets more narrower, it creates a greater resistance to breathing during sleep. So notice here, you'll see a tongue position is integral for development of maxillary morphology. What does that mean? Okay, so notice here, this is a high, narrow palate. Anybody that developed when they were a child, growing with their tongues down, developed a high, narrow palate, their tongue sits down low, and they have a little gap here. There's a little space between their palate or the roof of the mouth and their tongue. Guess what happens to their nose? It creates a deviated septum. So you have this nice high palate. High makes the roof of your mouth is the floor of your nose. So if that goes higher than it should, it starts to bend the septum. Without any injury to your nose, you get a bent nose. And guess what? Do you think this is an easy to breathe out nose? No, you can't breathe through this nose well. So what are the 4 potential places that you're going to have airway collapse? There's 4 places for the tongue to collapse. You have when your mouth is open, and the tongue is not likely to be on the roof of the mouth as the mouth is open. People say that, they think it is, but at night you want to keep your mouth closed, or else when you open, your tongue gets pulled because your jawbone's connected to your tongue. It pulls it down. So the airway can collapse at the soft palate. Here's a soft palate. That falls back into the airway. The tongue actually falls back into the airway. And the epiglottis, which is this right here, falls back into the airway. And the throat itself can also collapse. Okay, so mouth breathing, good versus bad diameter size of this airway. Remember, mouth breathing causes your mouth to dry out. And the architecture, we just saw that what happens to the nose, the airway gets very narrow and your nose gets bent. This also causes the jaw to fall back. If you have a good nose breathing during growth and development, you will have a forward position of your jaw, not only your lower jaw, but your midface. You want your midface to grow forward, not so much like a bulldog. You know how bulldogs have a smush nose? What draws the nose and the midface forward is the position of your tongue behind the front teeth, up on the palate. So if you'd be surprised at how strong that tongue is. That pressure pushes your face forward. It should. Every swallow should be reinforcing that. You don't want to be mid-face deficient, because then you won't be able to breathe through your nose well. And if you can't breathe through your nose, your mouth drops open. So a good airway is the size of a thumb. A poor airway is the size of a pencil. So you don't want a little tiny straw to breathe out of. You want a thicker size. The narrower the upper airway, the greater resistance to breathing and greater risk of collapse of the airway. Now this image, take a look at this image. This is a 3D cone beam. This is kind of the standard now to take a volumetric measurement of your throat. Now, not many people know they have an airway issue, but if you want to know, we have our doctors that we work with that do this type of work. This is actually a good airway size. Okay. This, can you believe that would not be so good of an airway to breathe through? So this is someone that has a very clenching problem, snoring problem. She's constantly has headache and tension in her head and neck. So this is hidden. This person would do really well with training her tongue, and for the meanwhile, protecting her jaw joint with an appliance that brings her jaw a little bit forward that will allow this to have a little more space to breathe. We guide patients. We really do our job to figure out what's happening and make sure we make the best recommendations to help them breathe better. So how mouth breathing affects the body. So it causes more faster, shallow breathing when you mouth breathe, believe it or not. It reduces the lung volume. Your throat actually will collapse more easily when you mouth breathe. Now, in cases of obesity, the tongue also increases in size and occupies more space in the mouth and in the throat, as well as increased size of the fat pads in the throat. Also, your belly fat causes us not to breathe into our bellies and reduces lung volume. So if you have a belly on you, you need to first learn how to diaphragmatic breathe. Use that diaphragm. The diaphragm is a muscle deep under your rib cage. And as you breathe in, it lowers. And as you breathe out, it ascends, it comes up. But there's some people only breathing here and not breathing at all in their lower belly. So you need to train the deep breathing, diaphragmatic breathing, but not big breathing. How to keep our airways open? It's simple. Remember this. To maintain an open airway during sleep, the muscles in the throat are designed to keep the airway open and supported by nose breathing. Number one, light, soft, gentle breathing, not heavy breathing, not big breathing, not fast breathing, light breathing, slow breathing, and deep breathing. Deep meaning low, so through your nose. Gentle, light breathing through your nose, slow breathing, and deep breathing using your diaphragm. So try this, snoring. We're talking about snoring here. So open your mouth and snore. Make a sound. And you can laugh at me, but this is the sound of snore. Right? Now try to nose snore. So close your mouth and try to make a nose snore. And what you will find, and I'll make it real quick, like nose snoring. I can't do it that well. It's not a good thing to try to really keep doing, but if you can nose snore, what you'll notice is that the turbulence inside your nasal cavity, you have to really breathe quickly in so the walls of your nose collapse. So the two factors of snoring is flow and airway size. So you increase that speed of your breathing, but you also constrict the airway when you do that through your nose. By making the size of the airway narrower and increasing the flow, you are going to increase the turbulence in that airway. So I want you to know that to practice tongue posture, you want to practice this now. Practice tongue posture. Put your tongue in the roof of your mouth. Okay? Practice slow breathing. Put your hand on your chest, your hand on your tummy. Take a gentle, light, gentle breath in through your nose. Pause at the top. Gentle breath out through your nose. Pause at the bottom. Gently breathe in through your nose. Pause at the top and gently breathe out through your nose. Pause at the bottom. Now, try to nose snore with that gentle movement up and out, breathing in through your nose and out gently. Try to nose snore. You can't. Why? You're not the volume and the turbulence that's created with big volume breathing doesn't collapse the nostrils at that volume and that rate. So you got to think of snoring not just as a problem of airway size, but like an engineer would look at the diameter and flow of your airway. It's just like engineering. When they see a tube, they want to think, oh, how much volume can I put through there? How much flow? But you don't want to push too much through it. In the case of an airway, if you breathe too quickly in and out of your nose or your mouth, it collapses the walls. And that's really why people end up snoring. We need to breathe through our nose slow and low. How to reduce snoring and address flow and airway size. So when we close our mouth stops snoring. So there's plenty of tapes that we recommend that go around the mouth that kind of keep your mouth closed for nighttime. To reduce nasal snoring, what do? We decrease the flow. So you need to practice. If you snore through your nose, if when we tape you and you're still snoring, chances are the volume is pulling in the walls of the nasal cavity. I do recommend nasal dilators. That's a really smart thing, like a breathe right strip or a mute. You want to start using them with tape. But when you are practicing slow breathing, such as the reduced breathing exercises that you learn in the session 1 of the Hobson Institute Breathing Clinic, you're going to reduce turbulence, and the resistance you're going to reduce of that turbulence in the airway. You're going to slow down your speed of breathing to a point of gentle light air hunger, we call it. Now, it has to be through the nose, and at the top of the breath, you find a point that you feel complete relaxation so that you have a gentle exhale out. So again, gently breathe in through your nose, tongue is up, mouth is closed, pause at the top, and gently breathe out through your nose, pause at the bottom. Breathing should be silent. Make sure that if it's not, the flow is too much. Gently breathe in through your nose, tongue is up, sit up tall, feet are planted, pause at the top, and gently breathe out through your nose, pause at the bottom. So what are our goals and what are the important points of this presentation? The goal is slow breathing on a permanent basis. Remember, we are busy individuals. The stress of life is causing us to breathe fast. So, one of the things we do is we connect our patients to a little machine that tells us how fast you're breathing and how well you're oxygenating and what levels of CO2 you have. It gives us a good sense of how good you're doing in breathing health. And a lot of my patients have no clue that they're breathing so fast. They're breathing 2 to 3 times the proper rate. So you want to know that that's the norm these days. We're putting way too much on our plate and our body is reacting by fast breathing, but we don't realize it because we take it for granted. So how you breathe during the day affects how you breathe at night. 2 aspects that you need to try to, adapt to is nose breathing and light breathing. Remember to breathe slow and low. So whoever has issues with snoring or sleep apnea, there is help for you. You do not just have to live kind of laughing that you snore. Do something about it. It's really unhealthy to not get a good night's sleep and to do it on a consistent basis every day. We have stopped so many people from snoring, and it can happen to you. So please, please, please don't be complacent. Try your hardest to improve your life and improve your health. And snoring is something that the Renaissance CranioFacial group of PhysioPartners can help you with. You can call 312-986-9833 to make an appointment. You can email me at any time if you want any advice around how to do things, how to set things up in terms of your breathing physical therapy at jenniferhobson@physiopartners.com. And you can also go to the Hobson Institute if you want any online pre-recorded breathing training sessions that you can do at the comfort of your home. And that's at hobsoninstitute.com. Thank you for your attention, and I hope you enjoyed this webinar.